So first of all, let me say that until 2016, Ghana as a country had not digitized its health records management. What it means is that when you go to any hospital, they will take a folder, which is a book, and then write your details. When they finish, they go and put it in a storeroom. When you show up the next day to see the doctor, they will tell you, wait, they are looking for your folders. And sometimes it takes hours on end to find your folder. In fact, there are instances where hospitals had to build new, structures to house the increasing numbers of folders. So it became clear that we needed to modernize our healthcare system. And what is interesting is that this project to try and start digitizing health records actually started under the NDC administration in 2016. So Lightwave, as a company that is into modernizing healthcare, wrote to the NDC administration and gave them a proposal which said that they could digitize our hospitals' records management, and beyond that, they could network hospitals so that if you move from one hospital to the other, you didn't need to move with your folder or carry a note, because once they key in your unique ID number, all your details will show up. They did the phase one. So the first contract actually was signed under NDC with Lightwave in 2016, 1st April. These are facts. The first contract, which was called phase one, was to network 25 hospitals in the central region, including the Cape Coast Teaching Hospital. When the job was done, then the country realized, the Ministry of Health realized that Lightwave had done an exceptional job by being able to digitize the systems of all the 25 hospitals. Based on that, they wrote and requested for an extension and a nationwide rollout. And remember, one of the conditions for sole sourcing is when you have a unique product which someone presents or has that has not gotten competitors, as if you don't have the same or similar things with others. So Lightwave was engaged based on the work they had done by the Republic of Ghana in 2018. The contract went to PPA. It was a proposed amount of $186 million. In fact, PPA approved the sole sourcing for Lightwave in 2018. But after the approval, it went to Ministry of Finance, and the value for money audit, the value for money audit team of the Ministry of Finance did some work on the proposed and approved amount and reduced the contract sum to $100 million, because they were able to show that some of the scope and all that was not really necessary, and that what we needed was the 100 million scope. So a contract was signed in 2019 for a nationwide rollout, which was to network and digitize over 900 facilities, my brother, from Tamale all the way, I said Tamale, from upper west, the top of Ghana to the down. Long story short, over a period of 8 years, this company has been able to digitize. And by the way, we have about 5 kinds of health facilities. We have the teaching hospitals, which have the huge numbers in terms of staff that must be put on this program or system, as well as patients. We have next in line are the regional hospitals. Then the next biggest ones are district hospitals, polyclinics. You come down all the way to health centers. In fact, we even have cheap compounds, but I think cheap compounds from the initial contract were not part. But this is the protocol. Now, the heavy work actually lies with the teaching hospitals. So the amount of work you have to do to, let's say, bring on board Confanoche and Okoe-Boye alone is worth 500 health centers. What it means that the health centers are small units. The average worker strength is about maybe 20 or 30 workers, compared to Okoe-Boye that has 6,000 to 7,000 workers, with patients also in the hundreds of thousands. So the point I'm making is that the Ministry of Health, and by extension, the government of Ghana, told Lightwave to start this project from health centers, which are small units, but to start from the top, which are the bigger units. So as we speak, every teaching hospital in Ghana has been networked and doesn't use folders. It has been modernized.
Right.
Every district hospital, every regional hospital. Now, why are we here? We are here because Lightwave was supposed to do this over a period of 3 years. They got an extension because this program is so extensive that the timeline is not only dependent on Lightwave. If Lightwave goes into a district hospital and they don't have the IT capacity to be able to absorb and be trained and to roll out, it affects the timeline. So after 31st December 2024, when the NPP administration were exiting, Lightwave had connected all hospitals except for some of the health centers. Although the number looks high, as in 500, the workload that is supposed to be done is just about 20% of the whole contract now. So they are almost there. And they've said that they need just about 12 months maximum to finish the job. Why? The reason why we're having these challenges is that we have the health minister who has refused to engage Lightwave in a manner that would get us to an amicable point so that they can continue to do their work. But Lightwave, let me conclude. Lightwave, my checks show that Lightwave is unwilling to provide support services because Honorable Akandoh has refused and has not succeeded in signing a service level agreement with them. And once the support service is not there, we are going to have some disruption. And that's why we are where we are.
We're where we are because the minister says that there was lack of performance monitoring by the former minister, and you were in charge of the Ministry of Health. I want to find out from you, how did you as a ministry monitor project's progress to ensure deliverables match the payment mode?
You know, my brother, there are very unfortunate things happening since the transition happened. We have some ministers behaving as if every public officer they meet at their ministry is an MPP person. I can tell you on authority that when we were there, for the 8 years that Lightwave was doing this job, Lightwave was producing a monthly report of progress across the country. For the 8 years that we were in office, the IT department of the government of Ghana, that's the Ministry of Health, has been working closely with Lightwave and has been monitoring Lightwave. In fact, there is a joint committee referred to as a steering committee, chaired by the Minister for Health. I was the chair. Ajumenu was the chair. It's a committee that has the Minister for Ghana, has Lightwave management, has our IT team. Since Honorable Akandoh came, he has not held even one meeting since he came, almost a year.
Right. Doc, if we can just stay on the issue, I wanted to find out exactly the level of monitoring you did as former health minister, so that because the forensic audit has uncovered significant irregularities. So I wanted to find out if some of the irregularities came to your attention as former health minister.
In the first place, most of the pronouncements, and I want to put this on record, most of the pronouncements of the minister are his claims. As we speak, you yourself have not seen the audit report. Myself have not seen the audit report. These are claims from him. He has kept the report in his pocket, the so-called report. He is speaking to wrongs that only he is aware. And let me say that he's made a lot of fabrications or false statements. The minister has claimed that our data as a country sits in India. That is a palpable lie. The data sits at the first floor of the office that he occupies. He has refused even to visit the first floor to look at the servers and the infrastructure. This is a minister that has a premeditated position. It's a minister that is interested in taking away the job of Lightwave to give it to a competitor. And as he speaks, that is exactly what he has done. Without the approval of any unit. And by the way, Lightwave was being monitored monthly and regularly. When we were there, the job was happening. No hospital across Ghana complained of disruptions with Lightwave. It is the behavior of the Minister of Health and his conduct that has resulted in all this. And in a bid to bastardize Lightwave, he has made a lot of false claims. To some, including that Lightwave is a foreign-owned company. The data is not controlled by Ghana. That is a lie.
Right. Doc, let's make progress. And I love to stay on the irregularities that have been claimed by the health minister. And I want you to clarify this for me. Why did the ministry continue to disburse over 70% of the contract sum when less than half of the facilities had not been connected?
All right. So, on the surface, the minister succeeded in hoodwinking or deceiving all of us. Although it is 450 facilities that have been done, the workload, in terms of the amount of work involved in the contract, the workload is over 75%. And let me explain, I've told you. All the remaining 500 health facilities, the amount of work that is to be done there constitutes only about 18 to 20% of the work that Lightwave is supposed to do. And this is the explanation. The size of the staff in those facilities and the amount of patients they see, when you put all together, the work to be done there is equivalent to the work Lightwave has done in only 2 teaching hospitals, Konfanoche and Okoe-Boye Teaching Hospital. And so the minister deliberately uses only the number of facilities. What it doesn't tell you is that a health center, it is about 1/100 the size. You divide it, you have to divide Okoe-Boye into 200 times before you get one health center. So please, in terms of workload, we, the Ministry of Health, then when we were in office, intentionally told Lightwave to go and start from the places where the workload was heavier so that most Ghanaians can enjoy from the system. Now, these remaining 500, what is even laughable is that this minister has engaged a new vendor who has not been tasked to go and finish the 500, which is equivalent to just 20% of the contract. The minister has asked them to go and redo and restart those ones that Lightwave has done already. And you know why? It's because their capacity is questionable. So please, before I even forget, the contract that was signed between Ghana and Lightwave said that if there is any dispute between Ghana and Lightwave, and within 28 days they are unable to solve it amicably, a third-party mediator must be engaged. Please listen to the term. This clause 28.1, 28.2 of the contract.
Right.
A third party, and at least I guess you understand why they mention a third party. When two parties are in the contract, and you have a situation where one is saying that you have underperformed, there are issues with you. It does not lie within the bosom of someone who is part of the contract or a party to make declarations. If they can't solve it amicably, then you have to engage a third party. And the third party is engaged because he can objectively look at the claims of Ghana and then look at that of Lightwave. As we speak, all claims have been one-sided, and nobody has been able to validate the claims of Honorable Akandoh. So
right.
with all due respect, treat all the comments of Akandoh as speculation, because neither yourself or myself have seen the so-called audit, and nobody has been able to validate the content of the audit.
Okay, since you work there, I just need clarification again, and it's back to my first question because I didn't get a satisfactory answer. I want to find out from you how much of the contract sum was disbursed. Akandoh says that 70%. As former health minister, how much was the contract sum that was disbursed?
Out of 100 million, Lightwave had been paid about 76 million at the time we exited. And as at the time we exited, the workload, when you take the work to be done, Lightwave had carried out about 75 to 80% of the workload. So what they received matched the work they have done. What Akandoh is doing is to cut numbers of health facilities. And I've explained to you, all the 500 health facilities, the workload involved over there is equivalent to just 20% maximum of the contract. So look at the workload and not just the raw numbers. Because the work to be done at one health center is not even up to 1/100 of the work that was done at Okoe-Boye. Please, if you pay attention, it will help you. We are talking about workload and not just health center.
Right.
Not all the health. Let me conclude. Not all the health facilities involve the same amount of work. The work Lightwave did to digitize LECMA is not the same as the amount of work you do to digitize Okoe-Boye Teaching Hospital. And so the minister has conveniently added all the health centers whose work amounts to little, and is using those figures to say that it is 50% of the work done. That is again another misrepresentation.
The minister says that you disburse for 70% of the total contract sum, and you're telling me that is the amount of work that was delivered by Lightwave. And so what assurance, when in terms of the 70% that was given, what assurance was given to the ministry that the rest of the work will be done?
My brother, Lightwave's work is a project that is ongoing, respectively. And with all due respect, there are many projects that have happened in this country that the timelines have to be moved once or twice. It's normal, it's part of project management. What you are seeing is a situation where you have a minister who sat on the ranking. Akandoh was ranking member for health. He was more or less the oversight person on the other side of the aisle. Akandoh knew of the work, excellent work that Lightwave was doing. But in coming to office, you can see a posture. What I suspect is that some of the people in this administration are just not prepared to continue with Lightwave. So instead of sitting down with Lightwave so that they can work together to complete the 20% of the work done, as we speak, Honorable Akandoh, and these are questions the journalists you must ask him. He has actually gone for a private person, a private company just like Lightwave, to start, not even to start, to redo the work that Lightwave has done. And with all due respect, this private company, because they are trying to hide the company, they have used the name Ghana Health Information Management Systems to deceive you and I that it is government of Ghana that is now doing the work of Lightwave, when in reality it is a private company. In fact, it's a competitor of Lightwave, another IT company.
Do you have evidence to prove that, Doc?
Oh, my brother, you are a journalist. The minister has told you that another company is doing the work in 4 weeks. I'm giving you 2 assignments. Ask the minister what procedure did he go through to land on that company, number 1. Then number 2, ask the minister. The company is a private company that will produce invoices to be paid money. Why is it that he is not using their name for the contract? Lightwave is a company called Lightwave eHealthcare Solution. So the contract name was Lightwave Health Information Management. Why are we being deceived with the name Ghana Health Information Management when it is actually a private company that Akandoh himself had in his pocket and has brought on board? I have given you 2 revelations. Go and check. Go and check.
Doc.
So this is purely, let me conclude. This is purely a situation or a case of a minister who has his own favorite company and was determined from day one to remove Lightwave and bring that company. And what is really funny is that this is a company with no track record of mass digitization. This company has digitized 3 or so hospitals in Accra, and these hospitals don't even talk to each other. When you move from one to the other, you have to carry your document. This is the company Akandoh is relying on,
right,
and has engaged without any approval from any state institution.
Again,
it is sad for Ghana.
Well, again, we're not able to independently verify that, but that's what we will.
With all due respect, the claims of Akandoh have to be able to independently verify. With all due respect, you see, you are not talking, so let's do that.
Right. In retrospect, Minister, would you say that if he had been more forthcoming with information about Lightwave in the past, we wouldn't have been here?
My brother, Lightwave, the audit reports, the monthly monetary reports have all been public. Everybody at the Ministry of Health involved with, in fact, the steering committee for Lightwave had the Director General of Ghana Health Service, had the CEOs of teaching hospitals. The work of Lightwave has always been in the light and not in the dark. This storm you are seeing has been created by Akandoh to serve as a basis to throw the company away. Let me tell you an interesting thing. When Honorable Akandoh set out people to go around under the guise of monitoring, some of them went to tell the hospitals that they were workers of Lightwave. Only for the workers to call Lightwave that, we have people who have visited us. They are saying that they want to audit your system. When we ask them for their ID, they wouldn't show us their ID. When they ask us how the system is working, and we tell them, oh, everything is fine, the system is working fine, then they get angry and say that we shouldn't say that. Can you imagine? This is a minister that sends people out on a mission to find fault with Lightwave so that he can do what is happening today. Look, all this is a setup. All this is being acted. He just doesn't want to work with Lightwave. I don't know whether it is about the money that is involved or about the company he wants to bring. And I've challenged Asasi Radio. Ask the minister, he should produce the audit report. And do you know what is sad? This minister has acted in many ways that are incompetent. Why am I saying so? You have carried an audit on a company that's working with you. The company says, okay, minister, we respect that. Can we have a draft copy of your audit so that we can respond to some of the claims made? Do you know what the minister said? He's not going to give them a copy. He's forwarding it to Attorney General for advice. How can you audit another party you are contracting? Refuse to show them the content of your audit. Claim you are sending the audit for advice. And even before Attorney General sent his advice, Akandoh already had another company. Please, all this is a setup.
Right.
This gentleman, and you know what is sad for Ghana? We have invested over $73 million, built a value chain that is unprecedented in Africa over a period of 8 years. And in the name of politics and incompetence, we are going to sink all into water. Akandoh tells you this new company is going to use the infrastructure built by Lightwave. Can you imagine? Infrastructure built by Lightwave. So in fact, they are bringing only software. Why are we joking with ourselves? Why? And you know, anytime there's a dispute between two parties, again, speak to your lawyers. Any meetings that are had, there must be transcripts. So that one side doesn't tell us something which didn't happen. As we speak, Akandoh has not showed us one paper transcript to show what happened between himself and Lightwave. All his stories are just being fabricated so he can push the company out and bring his company. This is sad for Ghana.
Right, Doc. Thank you so much for your time here on the Assassin Breakfast Show.
Thank you for watching. Like, comment, share, and subscribe.